Let us start today's class about electrolyte imbalances. What are the common electrolyte imbalances? What are the important electrolytes that we come across in a human physiology? One is sodium, potassium, calcium, phosphorus, and last one magnesium. So let us see each electrolyte. It should be maintained in the blood circulation, serum level, normal levels is to be maintained. In case if that level, normal serum levels is not maintained, it may be disturbance because of many other reasons. The levels of these electrolytes may increase, may decrease, which causes, suppose if take example sodium, in case if this serum sodium level is decreased, we call it as a hyponatremia. In case the serum sodium level of particular level increases, which is called as hypernatremia. Word hypo and hyper we use for increase and decreased levels. Even potassium, hyperkalemia, when the serum potassium level is increased, and when serum potassium level is decreased, it is called to be hypokalemia. Whereas calcium, it is if it in case the calcium level, serum calcium level increases, it is called as hypercalcemia, and if it is going to be decreased than the normal level to be maintained, it is hypocalcemia. Phosphorus, if it is going to be increased, hyperphosphatemia, and if it is going to be decreased, we call it as hypophosphatemia. And magnesium, hypermagnesemia, in case if the level rises, if it decreases, hypomagnesemia. Let us start today's class with the sodium level. If the sodium level is decreased, serum sodium level in the circulating blood, if it is decreased, we call it as hyponatremia. Hyponatremia, this is the today's topic, first topic. What is hyponatremia? It is an electrolyte imbalance. The first electrolyte imbalance, sodium imbalance. If it is reduced in the blood circulation, the serum sodium level is decreased in the blood circulation, serum, then it is called to be hyponatremia. And generally, as an introduction, if I want to speak, what is the use of this sodium in the blood? Why every human need this sodium in our blood means it helps in fluid balance. As it is present in the circulating blood, it helps in fluid balance, and it is going to help in nerve function, it is going to help in muscle function. So in case if the level is decreasing, there is an effect going to be seen on fluid balance, there will be an effect on the nerve function, and there will be effect on muscle function. So come to the definition of what is hyponatremia. What is hyponatremia? If the serum sodium level is less than 35 milliequivalents per liter, then it is called to be hyponatremia. So define what is hyponatremia. Serum sodium level is less than 35 milliequivalents per liter. 135 milliequivalents per liter. Less than 135 milliequivalents per liter is called to be serum hyponatremia. Now, what are the causes? What causes this hyponatremia? Generally in human physiology, the first reason is increased water intake. If a person is taking more than the excessive amount of water, there is a chance for getting into hyponatremia. There is a syndrome called syndrome of inappropriate antidiuretic hormone, that is SIADH, syndrome of inappropriate antidiuretic hormone. Here excessive release of antidiuretic hormone is observed. Because of that, there will be sodium electrolyte imbalance, that is reduced in the circulation, leading to water retention. As the antidiuretic hormone is excessively secreted, water retention will be more in the body, which causes sodium level to be reduced. And renal failure, if kidney is unable to function normally, then the more amount of sodium is being excreted. In that case, body will get into less circulating sodium. And heart failure, where the cardiac output is decreased, in that case also there is a chance for getting into hyponatremia. And the other pathological diseases like liver cirrhosis and usage of diuretics. Thiazide diuretics is one of the diuretic. When it is used, there is a chance of patients getting into, because more the amount of sodium which is present in the circulation will be excreted, there is a chance for getting into hyponatremia. And gastrointestinal losses, like if the person is having vomiting and diarrhea, there is a chance for getting into hyponatremia. And endocrine disorders like hypothyroidism and adrenal insufficiency, these are the disorders, or these are the general causes for the patients getting into hyponatremia.